And you think about a 200 head pen of cattle today, it's $500,000. Why would we not do diagnostics? Our highest performing health yards, everybody's aware of how many days cattle have on feed, how we're going to transition those cattle. Just because you have a baby monitor doesn't mean you don't need a mother.
Welcome to the Future of Beef Show in partnership with Drovers and Breeder. This is the place to connect with people, innovations, and success stories shaping the next era of beef production. I'm your host, Jim Johnson from Brands and Barbed Wire. As usual, I've got my global specialists with us today, Dr. Jessica Sperber, feedlot specialist from the University of Nebraska, and Ian Wheal, founder of Breeder, the cattle tech company championing producer-led beef supply chains. As always, you'll find additional resources and tools at thefutureofbeef.com with a free trial to Breeder app to take your operation to the next level. Today, we're joined by Dr. Dan Thomson with PAC. Dan, welcome to the Future of Beef Show.
Thanks for having me. It's great to be here.
Jessica, why don't you tell us a little bit about Dan and why we have Dan on the show today?
Mm-hmm. So we're lucky because we get a duo with Dr. Dan. He's a PhD nutritionist, but also a DVM. So when people say that nutritionists and vets can't get along, you just look at Dr. Dan and he gets along with himself most of the time. So you know that works. But really excited to have Dan here today to talk about lifecycle health from all the way from cow-calf up to the feed yard and how we see that impact on the rail. And then also about environmental stewardship and, you know, the judicious use of antibiotics and how that's going to impact our industry in the future and overall cattle health. So really excited to hear from Dr. Dan today.
All right. So Dan, why don't you tell us a little bit about yourself, your background, kind of how you got started, where you're from. Let the viewers get to know you a little bit.
Well, appreciate it. I was raised in Southwest Iowa. My grandpa, I'm a third generation veterinarian. My granddad started our vet clinic in 1938 in a town of 250 people. My dad joined that clinic in 1967. And I was basically raised in their veterinary clinic. And then I have a daughter now that's a veterinarian in Great Bend, Kansas. And so we have a son-in-law that's a veterinarian. So we spend a lot of time with cattle, a lot of time with animals, and a lot of time in the veterinary profession. But as far as my background, as Jess mentioned, I have a PhD in ruminant nutrition from Texas Tech and did my DVM at Iowa State University. Got out and consulted feed yards. I was the lead veterinarian for Cactus Feeders. And then after Cactus, I spent 17 years teaching feedlot production medicine and practicing feedlot production medicine at Kansas State University's College of Veterinary Medicine. And now am back in the private sector. I'm the managing partner of PAC, which stands for Production Animal Consultation. We just say people and cattle because that's what we deal with every day. And our group, we have 12 veterinarians that consult about a third of the cattle on feed in the United States. And we also have what we call the PAC Network, which is a group of cow-calf and feedlot practitioners, about 47 practitioners in clinics, and they cover 600,000 stockers and 1 million head of cow-calf pairs, mainly Western United States, North and Northwest. Personally, myself, outside of just the management side of things, I have clients that range from ranches, mainly feedlots, Kansas, Nebraska, and Iowa. And then I also work with all 4 major packers on cattle handling, animal welfare, antibiotic stewardship, and then McDonald's and other retailers on a routine basis.
Yeah, you consult for some animal welfare type things and stuff like that in your everyday life too.
Yeah. So I didn't ever think I would be consulting animal welfare, because I thought that was kind of this warm, fuzzy term, but really it's doing the chores. It's taking care of the animals that take care of us. And there is a science behind it. And it really stemmed from being confronted by animal rightists, which is completely different when you think of animal rights versus animal welfare versus animal abuse. Animal welfare is proper vaccination, proper nutrition, proper shelter, everything that we do every day. And so applying that and staying away from some of the moral arguments like religion and politics and animal rights and sticking to what we do in a truck on the ground and with the animals and the people, that's really where animal welfare and helping guide those companies, whether it's McDonald's or whether it's Yum Brand or whether it's Dine Brand, when they develop policy, is just like sitting in the room to say, a lot of it was it George S. Patton said, no good decision comes from a swivel chair. And a lot of times we have these retailers, especially that can get to a point where they make some decisions that necessarily they can't follow up on, where they have to pivot from a policy because it's something that they didn't get engaged with the industry to begin with. And so bringing us all along is what I do.
Yeah, that makes sense. So I got to know, which came first, the DVM or the PhD?
Actually, the PhD.
Okay.
And I was, like I say, in Dad and Grandpa's clinic in the 70s and 80s.
Yeah.
And that's the Key Angus cross cows and the Simmental cows. And I don't know how many calves we would pull and how many C-sections. And we were also kind of a glorified processing crew. We'd hook on the chute in May and unhook at Thanksgiving. And I was like, I don't think I'm going to do
I don't
this.
think you cut out for that.
Got done with the nutrition gig and just kind of saw the interaction. When I consult feed yards today, trying to understand that holistic side of veterinary medicine that includes nutrition, that includes husbandry, that includes, none of it is not interconnected.
Right.
And so I saw that niche and decided to, my wife about killed me because we already had 2 daughters at that time and had a third one while we were in vet school, to go back and bite the bullet and do it.
Interesting. So one other thing you said that I'd just like to add a little more scope to, you said a third of the cattle on feed. You guys work with a third of the cattle on feed. I mean, give our viewers sort of an idea of the size and scope of that, because I know that people may not know how many cattle are on feed. So, I mean, are we talking about 10 million or? We're
talking for us, cattle placed today in the yards would be between 2.5 and 3 million head.
Okay. Yeah, one-time capacity.
One-time capacity.
Gotcha. Yep.
And so that's kind of the scope. And we have everything from feed yards, 2,000 head yards, open front cattle feeding to, 85,000 head yards and in Southwest Kansas or 100,000 head. So it's different geographies, but mainly our practice is focused Nebraska, Kansas, Eastern Colorado, Western Iowa. Those would be our ground zero places.
Gotcha.
And how have you seen it sort of change? I mean, it's super interesting. Like, one, what you're talking about from sort of a connectedness of like from that cow calf through to the packer and how, you do that. And because we operate in Europe, we've seen policy be designed, which is completely irrelevant to the farm quite a lot. But how have you seen sort of the last, especially 10 years, like when we've really seen sort of pressure on the beef industry? How have you seen everything you've done doing change? How have you seen the reaction within the production ag, that relationship between a brand and the feed yards? Like, there's been we basically ran our own world before then, I feel, and now we've got outside pressure. So what's that doing to change?
I think the big thing is that when you look at the difference in the US, and I think you have to go back to, 40, 50 years ago, we spent 20% of our personal income on food inside the home. Today we spend 6%.
Yeah.
Okay. That's decreased. Well, the first thing people say is, well, we're eating out more. And that's not true. If you can go back to 1929, we spend 4% of our personal income on food outside the home.
Yeah.
And so the first question is always answered, right? How much it's a captive audience for quick service restaurants or for restaurants in general, right? Yep. And so the thing that you have to remember, the difference between food inside the home and food outside the home is that the grocery stores feed the masses. Grocery stores have SNAP coupons.
Yep.
Restaurants, regardless of which one, serve the rich.
Yep.
and they serve people who can afford to have someone else plan the meal, cook the meal, and do the dishes or the wrapper. And so when we saw COVID, the first place we ran out of food was the grocery store. The place we quit going was the restaurant. And so we learned which ones were essential. So with that in mind, if a new niche pops up in a restaurant, there's a captive amount of money that is in that system. And so it's going to take away from other people's potential because we know how much we're going to spend as a country out there. And so people either have to own the niche or discredit it to compete.
Yeah.
Our job is to help. We want to make beef competitive at every counter. So there's two things that we have to do, and it all revolves communication throughout the segments. And that is, we have to be able to help our retailers feel welcome on the farm, welcome at the processing plant, and feel truly integrated in our beef industry. While we're doing that, we have to listen to what the consumer is telling them so that we can make the changes so that when we're competing against chicken at the counter, we can win that order.
Yeah. And we've done a great job. You look at the numbers from last year, we're starting to really see that win. And do you think that is because of things, like BQA and all of that? Like that's been a big change over the last 20 or 30 years. But what are you seeing the top people do to really drive coordinated supply chains? Or I think you mentioned it's like virtual supply chains, but what are you seeing your top producers do to sort of deliver to that consumer need? Because it's working. Beef's back in a lot of ways. We should keep going.
I think the first thing is we have the best tasting product, bar none. There's nothing that tastes better than beef, and it's fresh. And so I think that is the one thing we can't, I always say you have to keep the main things plain and keep the plain things main. And fresh, food safety, these are the things that drive the consumer to beef. It's the other one is, with SNAP coupons, the beef is in the top 3 purchase. Ground beef is in the top 3 purchase with SNAP coupons. It's massive in this country. It feeds every socioeconomic strata. And so that's the other thing that's very unique about a beef carcass is from hamburger to helping those that can't help themselves to the white tablecloth restaurant to celebrate the biggest and greatest days of our lives. Beef's sitting there. And so I think that's something that we've done. We've really maintained food safety. On animal welfare, we just continue to share our story, continue to improve animal health. We've made animal health core, and I think that's one of the changes. When you ask, what about animal welfare? We did a survey with the McDonald's group, probably 15 years ago. And we asked consumers what animal welfare was. And if we asked 6 people, we got 7 different answers. Nobody knew what it was. But what came back out of that survey was that a safe food product came from a healthy animal. Yeah. And a healthy animal was one that had good animal welfare. And so instead of just being an animal welfare board, we became the animal health and welfare board. Yeah. And health then is core to everything we do with welfare.
Yeah, well, I was down at the Meat Institute a few weeks ago, and they are still saying the key driver for consumer attitude towards beef is animal welfare. So more than environment, more than any of the other things that sometimes we think it is, animal welfare was the number one thing that consumers are worried about, other than great tasting product.
Yeah, tasting, safety.
Yeah.
Fresh. There's been enough publications, but when you start to get into what I would call, the softer science things around a food product, how do you treat your animals? Were the animals, did you use good antibiotic stewardship? How do I know where did my food come from? Yeah, those kind of things are vital.
So let's dive a little deeper into that. Okay. And that welfare portion of it. And so sort of take us from a cow calf through to the feed yard? I mean, what's a good look like? What do you recommend for producers, and how do we make sure that our viewers and producers are all doing the right things?
Well, the first thing that obviously you have to have a passion for what we do, and get a veterinarian for health and welfare. Get a veterinarian involved in your herd, and understand the value of the little conversations and the consultations that we do while we're preg checking cows or body condition scoring cows or out doing this when we're semen checking bulls or things like that. Those little things, those nuggets and that information in that relationship. A lot of times as a veterinarian, my job isn't to tell you something you don't know.
Yeah.
It's to remind you of things you should never forget. And so I spend so much time. Redundancy is our friend. And knowing every spring, knowing every fall, knowing it's going to snow in the winter, knowing these things and being prepared and getting ready is just vital. Okay, that's step one. Then we start, we can kind of go through the life cycle on health, right?
Mm-hmm.
But it all starts with breeding that cow herd to where we get a lot of animals bred in that first cycle. And we want as many animals as tight as a calving window as possible. And people are like, well, what's that got to do with health? Well, yes, I have a lot of animals calving at the same time, and I'm keeping track of a lot of things. But when I go to do my branding vaccines and my weaning, I have more animals that are at the proper age to receive that vaccine relative to when they took in colostrum, that I will have more vaccine success. And obviously you have bigger calves to sell at weaning and things to that nature. But I would start with when the calf hits the ground, we want to make sure that calf is viable. We want to make sure that calf is doing well and it's able to suck, but we don't want to interfere. I see people run out to tag him right away. And I'm like, man, if that calf's able to get up and able to suck and spend time with its mother that first day, that is so vital to colostral intake.
Yeah.
And that carries on for the rest of its life. And likewise, if they don't get up and suck, I need to give a colostral supplement or a colostral replacement within that first 6 to 12 hours, not waiting till the next day, because then it has very little absorption. But if I'm talking about preventing calf scours and I'm talking about improved health of that calf throughout its life, that's where it all starts.
Talk to us a little bit about that. You'd mentioned that colostral vaccine interaction. So tell us a little bit about how that works.
Yeah. So colostrum is passive immunity. So the calf's born, he takes a big drink of colostrum. It's full of antibodies. And those antibodies, the first 6 to 12 hours, can just passively go across the gut wall into the blood. So anything mom's been exposed to, and she's created antibodies, what she's been vaccinated against, she's made antibodies, that goes across that gut wall. And then that calf has this load of antibody in his bloodstream to protect him against IBR, BVD, different type of mycoplasma, different types of pathogens. Mm-hmm. Well, that wanes. And so that doesn't, and so after about 5 days of age, the calf starts getting exposed to viruses that it sniffs in the bunk or on the hay ring or off the udder, and it starts to develop what we call active immunity, right? So it starts to anything it's exposed to in little bits and pieces, and it develops its own active immunity. And when we vaccinate, that's when we create active immunity. Now, the trick is this. If maternal antibody's high and I give an antigen, let's just use IBR. Yep. I give IBR, and maternal antibody is high for IBR from the cow, from the colostrum, that colostral antibody will neutralize the vaccine, rendering it useless. So if we give a vaccine when maternal antibody's at a high level, 1 week, 2 weeks, 3 weeks of age, it's neutralized and it doesn't create active immunity. Mm-hmm. So we have to play a game where we wait until the passive immunity is degrading to a point that when we vaccinate, the maternal antibody doesn't interfere. And that's usually why we brand at that before turnout at 3 to 4 months of age, is that we have enough of this deterioration of maternal antibody so that when we vaccinate, the active immunity actually will take on. And, the best way I describe it is somebody's like, well, when we vaccinate, when you get a puppy, they tell you to vaccinate at 6, 9, 12, and 15 weeks for parvo or whatever, or whatever. But what they say, the reason why they say it is because we don't know when the colostrum antibody in that pup is going to, or maternal antibody is going to wane and the vaccine works, but we know somewhere between 6 and 15 weeks it's going to happen. We just don't have that luxury in beef calves, nor am I recommending that you work them 4 times.
No.
But we try to do the best we can. So getting that tight calving window.
Ever wondered if you could be getting more out of your cattle?
Breeder is the first technology company that's able to track and optimize cattle from conception all the way to the rail.
This puts the power of data into the hands of the rancher and enables them to improve their profit line quicker than they ever have before.
My decision to partner with Breeder was made largely after seeing a demo where I realized what Breeder's doing is unlike anyone else in our industry. Connecting the data from the packing plant back to the feedlot, the stocker backgrounders, and the cow-calf, even connecting that data to the purebred breeder, will just open the door to improvement at a scale and a speed that we have never seen in this industry before.
I believe Breeder's putting ranchers in the driver's seat. We can make breeding decisions based on large amounts of data very quickly. The calves that are produced, they have a higher cutout value, their ribeyes are more profitable, and it plays back to us.
As I'm out around the country, people are asking me about Breeder, and I always recommend Breeder. It's the tool for the future.
Good colostrum management. I don't call it intake anymore because we have so many good products on the market that you can get colostrum in those calves. Making sure that you time your vaccines with those calves before turnout with your pre-breeding shots and that. Just all good management.
And you said 6 hours after birth is critical in that window, right? 6 hour window.
Yeah, some of the work that we did with Ben Wildman, we're trying to look at some of the SRP technology and if it would transfer in the colostrum to prevent against E. coli. And we would catch those calves before they would suck colostrum, and then we would take a blood sample. And then we would catch them at 6 hours, 12 hours, and 24. And it was amazing that by 6 hours of age, we could tell if that calf was going to be failure of passive transfer or not.
Wow.
That's
amazing. Yeah.
And we could still do something about it at that time, right?
Yeah, you can still put colostrum in. Yeah.
So it was, those were some things. I love biology and I love the medicine side of things, but this is truly a miracle on how fast those calves ingest it and it's in the blood.
Wow.
Yeah, and then you relate that to beef on dairy, where we've seen colostrum intakes be up and down over the years, and now people starting to realize, and it starts to explain why some of those cattle don't perform the way they should. It's amazing. So,
yeah.
Okay, Dr. Dan, talk about how the calves that are better set up on the cow-calf operation in terms of animal health protocol and animal welfare, how that transfers into the backgrounding yard or directly into the feed yard.
Yeah, so I use this example a lot, preconditioning, right? Getting the calves weaned, getting them used to a bunk. They know what a water tank is. All of these things decrease the stress. There's 2 reasons why animals get sick. An overwhelming dose of a pathogen that they're naive to or a suppressed immune system. And when we start talking about weaning and preparing these calves, we're vaccinating, doing all these things to bolster that immune system and make sure that they're not naive to something. But if we stress them before we send them to the feed yard or we transport them or we commingle them and all these things, we can destroy all the good work that we've done because, it's a stressed calf that the immune system's not functioning properly. But when you think about our industry and you think about how we're seeing, if you want to say something that's been the biggest win in the beef cattle health issue, is that we do a better job of vaccinating and preconditioning and preparing cattle for the feedlot than we've ever done.
Yeah. Well, yeah, we still see in the feed yards, like, I mean, we've seen a lot less incident of people like cutting tags out and all of that just because the traceability has become important. But we still see people revaccinating those cattle, which is better than not. But like, there's still a lack of awareness of like what sometimes has happened on preconditioning. And then, you know, you look at that and you're like, well, where do we buy the cows from next time? Like, quite often they are commingled and people aren't actually doing a lot of that assessment or that feedback. And going back to the cow-calf operation, say your genetics were great, but if you just preconditioned them to getting here, it would have been so much better. We would have paid X more for your cattle. And we see people pay more on the back of that.
Yep. And it's worth it.
Yeah.
We see it every day in the feedlot, the cattle that are managed properly at the ranch, that know what a feed bunk is, that know what a water tank is, that have been weaned, separated from the mom, that have been properly vaccinated, do so much better. And the other one that I think for us on feedlot is docility.
Yeah.
If we've almost undomesticated our cow herd, and unknowing to us, because of, you know, now we don't have bale rings where we're out walking around in our coveralls and interacting with the cows and the calves on a day-to-day basis. We pull up, unzip the bale, unroll it with flatbed and drive off. And so there's not that interaction with the cows. And then we have fence line supplement.
Yep.
So we come up with the cab on the tractor and we unload the supplement for the cows and we drive off instead of going out. You know, my grandpa used to carry 5-gallon buckets out to the bunk that they fed on both sides, and the cows would kind of bump him around a little bit, but they knew they were a caregiver.
Mm-hmm. To that point, for any of my dad's heifers that he knows that he's going to keep as replacements, he'll pull them off and he will hand deliver the feed to them for about 2 weeks so that they get used to him and it calms them down.
Yes.
Because just the human interaction is so critical for those animals. You don't want the first time that they are around a human to be when you're putting them through a chute when they're already stressed.
Right. And when we get to, when they get to the feedlot and they don't have that human interaction, they don't know that we're a caregiver. They think we're a coyote.
Yeah.
Mm-hmm.
And the biggest secret that a bovine has is its health. So the last thing it's going to do is let down its guard about its health to us if it doesn't trust us. So we have to work on acclimating the cattle within the pen to slow them down and to come to us so that we can identify disease earlier, which has been another huge movement forward in our yards, is that we're working with the cattle so that we can gain their trust so that we can detect, BRD or lameness sooner. And every time we do that, every day that we treat earlier, the higher the likelihood of a successful treatment.
Yeah. Well, we did a study at one point looking at what did it do for growth rate on an individual basis, handling them through the chute. And if you got cattle out, some of the ones which hadn't been handled, like they wouldn't get back to their original weight for 6 weeks. So for like, they'd come into the yard, you'd feed them, and it'd take 6 weeks for them just to get back to the weight they were pre-shrink coming onto the yard. And then you saw ones that had been handled, it'd be like a 3-day knock. You know, the ones that knew how to go through the chute, knew how to do it, 3 days later, they're back eating, they're back growing, they're back, off they go. Like, and if you think about how much we handle cattle, and, you know, we are handling them a couple of times through the feed yard, like the more that we can have those cattle so they're used to each other, used to going through a chute even, is like, because some of these have never been through a chute when they get there, which is even more stressful for them.
I think the important point to point out, though, is that we realize that the geography of the U.S. is very vast in terms of cow-calf production in the Northwest versus the Southeast, and what goes on in the Midwest in terms of cow-calf. And often a lot of our producers don't have the ability to handle their animals. They're born on hundreds of acres, and the first time they see them is when they're rounding them up to take.
When I was 18, I worked on 1 million acres in Central Australia, and those things were mad as cut snakes. They would like come in once a year, and first time they'd seen a human, you did not stand in the pen with those things.
Right.
So, you know, you can imagine what the stress does for them. So, but I agree, like you look at South Texas and they're gathering them 2 or 3 times a year at most. And then you go up to where you are, Jim, and it's, you know, you're out there every day almost.
Yeah. Yeah. And it's interesting. You see, I've been on cow-calf operations where you'll drive through on a truck or a side-by-side or something like that, and the cows are just calm and everything else. All of a sudden, somebody gets out of one of those and they're freaking out because they're not used to humans. They're used to cars and side by sides and stuff like that. And so it's interesting and what animals get used to and that type of thing. So what's the next step? So we're in this life cycle, right? We've talked about cow calf, moving them to the feed yard. What's the next step?
Well, in the feedlot, obviously, one of our big ones right now is labor, and the interaction of labor with just animal health is huge. And there's not a lot of people that are signing up to do our line of work, whether it's regardless of the job. But we can't find veterinarians either. I mean, it's not like it's, and so there's a lot of emphasis on getting cattle started, managed and preconditioned before they get there to decrease the workload at the feedlot, but we're still not there. So having enough pen riders, having qualified people that we work with and train every day, whether it's a farmer feeder walking their pens or whether it's on a four-wheeler or whether it's a horseback, we are constantly working on training on which animals to pull, when you pull them, getting the right animal at the right time with the right treatment process is vital. So working on that, but none of this is disconnected. And that's what we start to put the animal health bucket and the feed delivery bucket and the yard R&M repair maintenance bucket and the feed mill bucket and all that. And we all need to sit around the table if there's a lameness issue or a BRD issue or a digestive health issue, and how does the team solve the problem?
Yeah, the feed truck driver is part of the animal health crew.
Big time.
Majorly.
Yeah. And so, trying to think of ways that we can, everybody wants to, some of the new technology is really, really cool, but just having a dangle tag with a number on it, a big number that everybody can read, is massive to animal health, because somebody can drive by and say, hey, did you see number 11 in pen 9? You guys need to check that one tomorrow. And so those are some, just the communication level across teams and across crews. Our highest performing health yards, everybody is aware of what performance is. Everybody's aware of what, how many days cattle have on feed, how we're going to transition those cattle. They're talking about, hey, we're having increased morbidity in them. Let's slow down, or let's wait and transition those cattle after the health is taken care of. Those feed yards are miraculous, and they constantly keep their death loss below 1%. And so I would say that those are while we want to focus on the things that come in a bottle, they're probably down there at so low on my list of, pick a 5-way, they work. Pick an antibiotic, they work. The big thing is that what weather patterns are we experiencing? How many new cattle do we have in the yard? How many people do we have to take care of this? Because, when we talked about when COVID hit, and I think this is something that's very similar to feed yards, we said we wanted to flatten the curve. And the reason we wanted to flatten the curve was so that we didn't have the hospitals overrun, so that doctors were fresh, nurses were fresh, and that. And when we get into the fall rush in the feed yard, our crews get overwhelmed, our management gets overwhelmed. And so if we don't have enough people to begin with, these are the kinds of things that can really, really, things start to slow, this calf doesn't get its treatment, this calf doesn't get found. Those are our biggest issues.
So, labor is, every yard we go to, labor is a massive issue at the moment. And you talked, we're on the Future of Beef show, so you talked about the technologies. I know, with our app side of the business, we've integrated active tags and various other things. What do you see as the technologies out there that are interesting, work on a feed yard? Because I think when I look at any ag tech, as we put it, there's a lot of cool ideas out there, but stuff that actually is affordable, drives action, practical. I still don't see lots of technologies that fit those bills. And so I'm really interested in sort of your thoughts on that.
Well, we started using some of the different active tags and wearables, and I'm not going to endorse anybody's product, but there's great technology out there, and they work. They find cattle that need help. The thing that, everybody says, well, hey, if we're going to buy this tag and put it in their ear so we get, we don't have to have as much labor. What we found is the opposite.
Yeah.
When you use the technology, it finds out how many animals we actually should be pulling.
So you need more labor.
And we need more labor because we have let this become the new normal.
Yeah.
And that's what the technology is exposing to me. And we have a lot of people say, well, you're going to use that tag. You just want to take away my job or, and I told Jess that, just because you have a baby monitor doesn't mean you don't need a mother.
Yeah.
And so the technology says, hey, this calf, whether it's behavior or body temp, and I really like both in the tag, because we have cattle that will adjust their behavior at the beginning of the outbreak.
Yeah.
We all work with people, right? That some people get a hangnail and they don't come to work for a week. And some people come in, with blood coming out of their eyes.
Yeah.
And you're like, go home, please. Well, cattle are the same. And so the ones that are like, oh, I don't feel good, they adjust their behavior. And we find those early with the behavioral movement. But then the ones that are toughing it out, their body temp goes up.
Yeah.
And we start to pull those in the second phase. And so those, but as far as decreasing death loss and finding early pulls, that technology works great. The other ones are maybe the non-wearable, where we're endpoint management.
Yep.
is crucial. It's one of the hardest things that our producers, all the technology we use, like beta agonists and implants and even some vaccines, are driven based on endpoint.
Yep.
So if we don't know where endpoint is, we don't know when to optimally apply the technology. So we always are working backwards. And so technology that helps us get a better endpoint on cattle and sort and those, I think those are what we're seeing as crucial.
Yeah, and look, there's been a lot of ones out there which are doing the hip height. We're now seeing like the genomic sort and in a number of yards where people are using genomics to do it. And I think what's been really interesting with things like Xperia now becoming pretty widespread is, when you're thinking about pulling cattle to go to the packer, like you're not making that decision 2 weeks before now, you're making it effectively 6 weeks before, because once you start on that Xperia, they're going, right? Once they get to the end point. And we've found that super interesting, because now you've actually got this point where you're like, should we sort them now? When do we sort them? Be able to put them onto Xperia, because that sets your time zone and timeline of when you're going. But yeah, the genomic sorting stuff, we've seen some really good results from that. Like when you look, especially for the bottom 10% and the top 20%, fantastic. I think there's still work to be done in the middle because there's just a little bit of uncertainty. But you'll look at a pen of cattle and be like, yep, they were the worst. It's very interesting.
And I think that's what we've discussed too, is that epidemiological triad of pathogen, host, and environment.
Yeah.
And right in the middle of it is management. And so what you're saying, I agree 100%. We take the genetic information plus what the cattle are going to be exposed to in an environment, and being able to marry all this. The more information we have and the ability to assimilate it and sort it and remove our biases, that's been the hardest thing as we work more and more in our practice with AI in our data set. And we have to remove ourselves because we're so biased. They just did a study with human patients, and they had the AI bot versus the MD with the AI bot on taking clinical information and probably genetics and whatever
everything.
It has.
Yeah.
And the AI bot was able to clinically diagnose patients 94% of the time correctly. The MD was like 74.
Wow.
And the MD with the AI bot was 76. Because the MD wouldn't
believe it,
overruled it, and wouldn't let their ego or their ability. So we're going to have some massive adjustments mentally to letting it do its work.
Yeah, we want our Feedlot Health crews and our cowboys to still be aware that they know what they're doing and that they can make a good judgment call. But there has to be some give and take on allowing the AI and allowing the technology to help you do your job better. and to help you retrain your eye in some scenarios. We're not saying that you don't know your job better than anybody else, because we know you do, but it's allowing yourself to get better with the help of the AI.
Yep. Yeah, and there's two types of efficiencies, right? And we see it economically. There's the cattle and there's the operation.
Mm-hmm.
Yeah.
And the cattle efficiency, the AI was pretty easy for us to kind of understand performance and health and carcass and genetics, and it all comes together and spits out some. But the operational efficiency is another one that, as we get overwhelmed, how do we optimize the people that we do have within the feed yard to provide the best care and make sure we aren't duplicating effort and that we're not missing effort? And so these types of things is where I see our future.
And I think that's the challenge. I think a lot of, from a tech point, we're trying to solve now is you can look at it like in the past and be like, look, the AI did a better predictor and it's great, but you need it to happen like that week or that day, and you need it at the shoot, and you need to be able to drive action out of the back of it. And I think, how do we get this technology to help drive action? And I know a few of the tags are putting things like lights on them and stuff like that. And we're putting, like, even with what we're doing, we're putting way more at the shoot now so that you can see all that data as they come through, which didn't exist before. But it's, yeah, I think there's a big challenge of how do you take the AI and make it actionable, or how do you get all of this stuff to make it actionable? Because from a science and data perspective, you can analyze it and be like, we should have done this, but it's too late.
So what we have to do is you have to, like what I'll just give an example of what we've done. We've had a database that downloads data from our feed yards every night at midnight.
Nice.
And it's been doing it for 20 years. And so being able to have those sorts of, at the beginning, it was just like a grain bin, right?
Yeah.
To just keep adding corn and more data. And we didn't, we'd go about our business day to day in the feed yards, and we'd say, oh yeah, here's the 5 checkpoints and let's move on. Now we're using it to be predictive.
Yeah.
Now we're using that data to say, these cattle from Georgia that are 7 weights placed in Nebraska in January.
That's awesome. Yeah.
Here's the processing. Here's their endpoint. Here's their technology. I mean, it's where we have to continue to get.
Yeah, because you think so many of these yards, it's like, this is our protocol. But if you've got different cattle from like cow calf versus beef on dairy versus anything, like, it does not make sense to treat them all the same.
No, and now we're seeing custom vaccines, right? Like the some of the different vaccines that companies are able to make on the current construct of viruses that we're seeing, whether it's coronavirus or IBR or BRSV, rather than something that was the construct 30 years ago. And so you're going to see that when we're getting cattle out of Virginia or out of Mississippi or different regions, as we do surveillance, we have a project called Certified Sampler where we take the nasal swabs of cattle on arrival. Well, if we start to look at different endemic diseases from different regions, maybe there's a virus or a strain of coronavirus in Central Texas or in the cow herd and such, because everybody's using the same sale barns and the same auction markets and that. And it would make sense, right? That we would have regional pockets and then they all come to the feedlot. Well, if we know that these calves are coming from this area, I think this is the future, is they're coming from this area. We'll use this strain of this virus. Or we find out, you know what, you don't even need to use the vaccine.
Yeah, because they're already built their immunity up. For it, so.
Or
let's talk about antibiotic stewardship.
I knew she's going to get.
Yeah, she's wanted to go into this one for a while.
You said it.
I got to sit up a little bit straighter, Jess, and we're going to talk about that. Oh, antibiotic stewardship. The first thing I would say about antibiotic stewardship in beef industry is it's not a number. All right, everybody wants to measure things.
Well, before we get started, tell us what that is. Tell us what antibiotic stewardship means.
Okay.
In the beef business, every decision counts. Drovers delivers the expert analysis, market updates, and real-world reporting that cattle producers rely on to make smart, profitable decisions. From market updates to policy shifts and animal health, Drovers delivers expert reporting and real-world analysis that helps producers stay ahead. With the mission to help beef producers become more profitable, every story is built around what matters most to the cattle industry. Get informed. Get Drovers.
I'll tell you what it means to me. What it means to me is that, number one, antibiotics are are incredible essential tools for human and animal health. We need more antibiotics. We need better antibiotics. And every time that we talk about decreasing antibiotic use, people sitting in the corner office of a pharmaceutical company say, well, I don't want to work on any more antibiotic projects. People don't like them. We need to send the message loud and clear, keep bringing us better tools, better antibiotics, and keep working, okay? Then when we get to the stewardship is getting the right antibiotic in the right animal at the right time. It's a One Health type of initiative. And what I mean by One Health is understanding the triad of human health, animal health, and ecosystem health. And so healthy people, healthy animals, healthy planet. And we work day to day on helping train people find the right animal. We work day to day to make sure that we have the proper protocols, utilizing the products in a safe and effective manner. And we are making sure that each and every day, nobody wants to use an antibiotic, but they're essential. So the core to antibiotic stewardship is a veterinary client-patient relationship.
The alternative to antibiotics aren't good.
Right. Yeah.
I mean, it's
chronic illness and death.
Yeah.
And so working with your local veterinarian, working with a consulting veterinarian, working with veterinarians is core to antibiotic stewardship. Then it is proper clinical diagnosis, proper treatment, proper follow-up. Okay. Proper withdrawal time. Mm-hmm. But it's something in totality. And what we have to understand is that while there are groups out there that want to have, well, you can use this many antibiotics, right? Or this arbitrary limit of milligrams of antibiotics per kilogram of animal slaughtered or whatever. I can't control a blizzard. Some years, what I'm trying to say is that some years, if you're going to use antibiotic use as a indicator, which is something we can measure and it's good to look at, but really you have to dig into the context in which the antibiotics were used. And so if we feed cattle to longer out weights than we feed Tylosin, mm-hmm. we're going to see increased antibiotic use. Mm-hmm. But we need to understand why. It's not because producers are using them.
We're not lighting them up.
Right. It was just a bigger biomass of the cattle.
Yes.
Right. And we have to understand that if a blizzard comes through and our pens deteriorate and it's the fall and we're overwhelmed with calves and we have a new virus come through, the years that we have some of the best antibiotic stewardship might result in increased antibiotic usage mm-hmm. because of we're taking care of the animals. And so when we see So defining stewardship is really about understanding that antibiotics are essential and that we want to use what we need to use to keep the animals healthy and then try to eliminate uses where they're unnecessary.
Yeah, I think the thing that you mentioned, Dan, was assigning the right clinical or the right disease or bacterial challenge, whatever it is, to that animal. I think right now, so that you can use the judicious practice with the correct antibiotic or whatever regimen you want to use. I mean, right now in the feed yard, we're having a challenge with hairy heelwort or digital dermatitis. We really are. But for a long time, and we've really started to notice that we have it now. But I think it's because we're becoming more aware that it's more than likely hairy heelwort and not a foot rot. 5 to 7 years ago, we weren't picking the feed up. We were giving an antibiotic dose or, trying to treat for foot rot on cattle that were having hairy heelwort challenge. And so as we become better at clinically diagnosing animals in a feed yard or animals in a background or on the cow-calf operation, just picking the foot up allowed us to realize, oh, this actually isn't a foot rot, it's a hairy heelwort challenge. Now I'm going to change my protocol.
Yep. My other motto now in feed yard medicine is quit guessing. Mm-hmm. So many times we just guess why we have a swollen hock or why the calves broke with BRD. And you think about a 200 head pen at cattle today, it's $500,000.
Mm-hmm.
Yeah.
That's equivalent to 10,000 feeder pigs.
Yeah.
Now, why would we not do diagnostics?
Well, yeah. Why are we just darting an animal from a distance and not even going in and pulling it out?
Why aren't we? Why would we not do so? So we've really, in our practice, really ramped up diagnosis and diagnostics to get to some of the answers. We don't know if it's going to make a big difference in treatment outcome because it takes so long to feed cattle, and it's going to take. This is going to be a 5 to 10 year project that we're planting trees that we'll never see the shade of. But if we don't start to change, I don't know of a pig vet out there that wouldn't do diagnostics on 10,000 head of feeder pigs that were breaking with PRRS or PED or, now I'm not saying their outcome would be different either, but at least they're starting to get some understanding of how to prevent these problems.
But I think that is antibiotic stewardship.
It is.
Yeah.
Judiciously using the product by actually diagnostically testing what was wrong with the animal.
Yep.
How does that change how you're interacting with your customers? Like, are you doing much more of a video call and photos and text message? Like, because that's like, you think about your labor versus their labor, like that's a challenge. There's people who wouldn't know how to diagnose that, yet they're writing pens.
Our strength of our veterinarians is being on the ground at the yard.
Yeah.
We can't replace the face-to-face human in the trenches interaction in our feed yards.
Yeah.
We've been doing telemedicine since, my dad and grandpa did telemedicine. It was just a phone that was attached to the wall at the house or the clinic, right? But I see telemedicine being a huge opportunity for us, especially in what I would call underserved cattle feeders. We have a lot of underserved, and Jess and I have talked about this before, but people would say, well, I'm not big enough to have a consulting vet or have that consulting vet relationship. And I'm sorry, but when we're with the price of cattle today, I don't know how somebody that's going to feed any even 1,000 head yard needs some sort of interaction and understanding of implant programs and vaccine programs and treatment programs and clinical observations and that. And using the telemedicine is going to be huge for us because it's not just our time. We think about our time, but somebody that's got 2,000 heads of farmer feeder.
Mm-hmm.
Yeah.
And right now they're all in the field planting.
They're all planting, yeah.
And so they want to just dial up because the tractor will drive itself. Hey, if I can get an hour consult, we can go through things, but we still have to be there to maintain VCPR. We still have to be there to maintain understanding of cattle flow, people, interactions, but there are a lot of things we can supplement. Telemedicine's going to be fun.
And you mentioned earlier that, the in human health, the AI bot was doing a better diagnosis than the doctor. I mean, when do you see that coming in the feed yard where a pen rider can take its phone and scan the animal that potentially sick and send that to you that you can use AI to diagnose the animal?
And I tell you, it just amazes me every day. What I don't know.
Yeah.
I just know that we miss more by not looking than we do by not knowing. And you got to take the time. We've got to walk the pens, ride the pens. We've got to do a clinical exam in the chute. We do a lot of lung auscultation and rectal temp and look at the clinical signs and come up with a clinical score for every animal. And then if one dies, why? Let's open them up. Let's do a necropsy. Yeah. But for as far as our surveillance and that today, doing some upfront surveillance on arrival. What are they bringing in? Doing surveillance during pen outbreaks. Why are they getting sick? And then doing necropsies when they die. Why did they die? And doing diagnostics at death. But the difference between us and the poultry and the pig industry is time. Mm-hmm. It takes 2 years or it takes 14 to 16 months to get that calf from birth to slaughter. Right. And when we talk about genetics or we talk about diagnostics, we're really good at collecting data. We haven't been very good at keeping our interest and keeping hooked to when the animals actually close out and start to match the outcomes, whether it's a health outcome. Because there may be diseases or viruses that calves bring in. Let's say it's a coronavirus.
Yeah.
It's a coronavirus. And we have high morbidity, but low mortality. So maybe you stay out of it, you know, or something that we can intervene and learn interventions. But we haven't matched what they're bringing in with the final outcome. And we need to do that over year so that we can start to understand and let the machine do the analysis. But
it leads into like our last very link in the chain, right? Which is where we are as cattle feeders, which is to go from what can we do on the feed yard to have a better outcome for our customer? And our customer at the end of the day is the packer, right?
Yep.
They're buying our cattle, they pay our checks, they're the people who come through and do it. You know, we've been doing some stuff on liver abscess, like that's one challenge, but yet we can't get individual liver abscess because it's on a lot basis. You know, what do you see as sort of the big opportunities there in terms of what we can be doing on the feed yard to help influence and provide a better product really to our customer at the end of the day?
And, you know, we're doing more of that now with our One Health initiative and our database. It used to be we would just focus on the feedlot data.
Yeah.
And now we're integrating the data on condemnation rates back into, because liver abscess versus a lung abscess, it's still health.
Yeah.
And the veterinarians, and what we've done is we've put that as, well, that's a production disease. But if you understand whether it's bloat or laminitis or liver abscess or diphtheria, whatever, it's still an individual animal phenomenon that we manage at the pen level.
Mm-hmm.
Yeah.
And so we only get pen level data, and we feed them as a pen.
Yeah.
We see this beautiful feed graph for the pen, but inside that line is chaos.
Mm-hmm.
It's individual animals over consuming and going off feed and over consuming and go off feed. And so really it's kind of like, a lot of times I think the optimum health is kind of like teaching to the bottom of the class. We've got to bring all the cattle in the pen along while we know that there are cattle there that want to go and transition them to a high finished diet, and, you know, within 21 days or 24 days. But I think we have so much to learn on liver abscesses, on liver health, liver maintenance, even some of the copper levels and some of the research that we see on the ability of the liver to decrease inflammation.
Yeah.
How quickly we transition these calves, how to a finished ration, what is the composition of our finished ration, and now we're learning more and more about lower gut health, combined with environment that has an impact not only on the liver. If there's an impact on the liver, it's also on the lungs, and so if I had an answer to liver abscesses, which I've studied a lot. I would not be here. I would be on my island with a drink with a small umbrella in it. But you know, I've done a lot of work with guys like T.G. Nagaraja at K-State for my career, and we've had vaccines we've tried. There's just no substitute right now in liver abscesses at the end of the day, roughage or Tylosin.
Mm-hmm.
Those are our two.
High roughage.
Roughage.
Yeah.
Yes.
Yeah, just get that gut going and get the gut development is what we've seen. It's like, you know, leaky gut in an early years can lead to liver abscess at the end.
Yeah.
So,
it's a major issue. We continue to have it decrease chain speed at the plant.
Yeah.
We need to be able to incorporate it into health programs. We need to get that information back and start incorporating it and studying it just like we study bovine respiratory disease or just like we study lameness. And we need to pull that into the animal health portfolio, which is still holistic in all of us. But I think if we bring that as kind of the, you know, something that we can manage and understand and start to learn from, then maybe we can get some of the answers.
Well, it's probably another one which I'd spring on you we didn't talk about beforehand, but like congenital heart failure, you know, it seems to be a big topic everywhere at the moment, linking it to PAP score, not linking it to PAP score. Like, as much a question for you, Jess, probably as it is for Dan, but like, where should we be going there? Like, these cattle are getting heavier. It's becoming a bigger problem. What do we need to do to help sort that one out as well?
I think the big thing when we look at any of these is we really need to get better diagnostic evaluation. And what I mean by that is making sure that what we are calling a heart failure is actually that. And so I don't feel it's as big an issue in cattle feeding situations as what is being let on. But I have a lot to learn about that syndrome. But we still to this day, we don't see it. I guess at the end of the day, I would summarize this, that when we start to see the late day death loss, and we break it down by region of the United States within our practice, there are pockets where it's hotter, and when it's hot with overfinished cattle that have been asked to be on feed for 240 days with 7% roughage. Paul Cusack's work out of Australia shows the inability of the rumen to continue to buffer and a continuous decrease in acid load in the rumen. I think that we need to get back to a holistic view of what's going on with these animals. When we look at Iowa, Nebraska, and wintertime and late days, we start to look at heifers maybe that are breaking down musculoskeletally at the end of the feeding period. And so the congestive heart failure, right-sided heart failure, high altitude disease, have been around since Moby Dick was a minnow. We've been studying these. We've been studying. Well, we when I was in practice in Greeley, we'd have the high altitude disease, and we'd link it back to one bull or two bulls, right? And then when that was 25 years ago, and so we get better technology, better analysis, we'll get better answers to understanding this. But in my opinion, the heart failure issues at death loss in feedlots is way, way, way down the list.
It's interesting. Yeah. And you're seeing it every day. So
we're necropsying, unfortunately, we don't win all the battles, but I would say that it would be, it's kind of like getting into the traceability discussion or into the animal welfare discussion if you don't have a good tasting, safe food product. All right.
It's all irrelevant.
This one is really something that I think has drawn interest because there's a genetic component and there's a pathology component, and the two groups are energized to really dig in on it. But if you look at it in the grand scheme of things, I think we had 600 out of 6 million cattle that died that were diagnosed as heart failure in our practice in a year.
Wow.
So
so let's focus on the livers.
Let's focus on the livers. Let's focus on the cattle. I'm not saying that we don't focus on cattle health in general.
Yeah.
Because up front, middle of the feeding period, and end of the feeding period all have their challenges that we have to attend to as veterinarians and as producers. The ones that happen at the end are the most costly and the most ones that make you hit your head on the roof of the pickup because you're like, holy smokes, there's a $3,000 animal, right? So the economics is driving some of this as well. So I'm not saying that let's can it. I'm just saying let's really get all the right people in the room to have the discussions, because we're getting in our silos. And if we're going to solve something, we can't do it without, just like we were talking about, everybody's got to be around the table. And that's why I went to grad school. And really, the reason why I went to grad school and to vet school was just so that I could argue with myself.
Yeah. Oh, good.
Your wife must love those conversations.
My wife is a veterinary microbiologist.
Oh, wow.
Yeah. So she's
that's a household.
It is. Our Thanksgiving dinner discussions are pretty fun.
Great.
One last question for me, but so much of what you've talked about through here is like how you're hands-on. So much of what I feel in the industry is like, as technology's changing, as everything else is changing, is that sort of culture to learn. And from what I hear from you, it feels like so much of what you're doing at PAC is actually almost cultural change sometimes on some of these feed yards and cow-calf operations. Like, how do you build that within your practice? How do you interact with your customers? Like, how do you see that as being an important part of how you interact, not just treating an animal that's sick there today?
That get me emotional. I mean,
that's the idea.
And we love each other. I mean, our clients, our veterinarians, our staff, life's too short to not work with people you care about and that care about you. And we all care about the cattle.
Mm-hmm.
Yeah.
Mhm.
And so we spend as much time, focusing on each other's health, focusing on the health of the operation, leaning in when we need it, so that when things go to sheep pellets, there's a level of trust and integrity and know that what we're going to do is absolutely the best for each other. And that's core.
Yeah.
That's our mission is to change lives through veterinary medicine.
Yeah, it's great to hear.
Yeah.
Thanks.
Awesome.
I do have one last comment.
All
That
right.
was a great wrap up. What are you talking about?
No.
So
Let's make it a little more lighthearted.
this is gonna it's not gonna be lighthearted, but from the diagnostic testing side of things, I've been on a few operations, cow-calf, that maybe they'll have a cow die. They don't know why, but they don't want to get it diagnostic tested because they don't want to have a bad eye turned on their operation for that one female that went down. What would you say to a producer in that regard? Like, I mean, we have vet diagnostic lab at UNL, and they've now figured out different diseases or genetic transfers for the Hereford breed. Like, what would you say to a producer to get them encouraged to go and have the vet there, but also do the diagnostic testing?
Yeah. So, it's no different than the privacy of your own personal health information. So if you have a cow or a calf, we have confidentiality agreements and an oath as veterinarians. It is a relationship. The high level veterinary client patient relationships are similar to you and your MD.
Yeah.
And we see the best and the worst times together. And getting that diagnosis so that you might prevent the next one is important. And it was funny because my dad would always say it was easier for him as a veterinarian to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars. And so taking the time, getting the diagnosis, and even if nothing happens from it, right? I hear producers say this all the time. Well, we did that, but it didn't do any good. Okay, but the time that it did is why we did we don't quit going up to bat if we strike out once. We get up there and dig in because we know we're going to hit it the next time. And so that's what I would say is that really have faith, lean in on your veterinarian, push your veterinarian to be better, push your veterinarian to go to that next meeting, say, what CE are you going to? What new technology, what new diagnostics, what new vaccine, what new thing are you doing? Work with people that match your motor. And likewise on the veterinarian producer side, that would be it's not public information. It's just you and your veterinarian, and it's peanuts for the price and the information that it potentially could answer.
Well said.
Quit guessing.
Yeah.
All right, any more?
No.
You good?
I'm good.
Ian?
I'm great. Thank you very much,
All right.
Dan.
No,
Yeah, thanks, Dan. Thanks for your time,
That's
and
great.
we enjoyed the conversation.
Thank you.
Thank
It was a lot of fun.
Yeah, good to have you.
Yeah, thanks.
Stay tuned. It's time for Ian, Jess, and I to go behind the beef. All right, so back to a little behind the beef action here with Dr. Dan. So what do you guys think of that conversation?
Oh, Jess has known him for longer. I'm let her go first.
I knew it would be a a thought-provoking episode for sure. I think that there's a lot to diagnosing the symptoms that you see in animals, but especially if they did die during the feeding period or at the end of the feeding period, figuring out the diagnostics for that is critical. We can't measure, or we can't diagnose what we can't measure, or change what you can't measure. So I knew it would be thought-provoking, but I really enjoyed it.
Yeah.
Yeah, I think I appreciated just the challenging of what we might commonly think of things, right? And just saying, okay, is this really right, or could it be this? Could it be this? And I think that's probably, what makes good veterinarians, right? Because they're looking at things and they're challenging the
well, it's great to see someone with a nutrition doctorate as well as a veterinary degree, right? Yeah. It's big, but I think, look, it's exciting what they're doing at a practice, and like obviously, like I clue on to a lot of that cultural stuff because I think like we've got a massive change, and it's only accelerating technology and help and change in the industry over the next 10 years. It's not going to slow down. And how they're already using AI themselves, how they think about culture within the practice. Like we were talking before, and the way Dan brings on other vets into that PAC group is like, it's a cultural fit before anything else. And are they thinking in the same way? So I think like, I like that. I think, the challenge you have is it's such a big problem, and, collecting data in a consistent way every time to use AI models is hard. We know we're doing it every day. But I like what they're trying to achieve. And not to say they haven't taken on a massive challenge, but they're working with a lot of different people and everyone operates in a different way. So yeah, but there's some big challenges there, like liver abscess, those sort of things, how that works within the packers. I liked what he said about antibiotic. I think there is a challenge there, though, in that that's not how the McDonald's and the Yum brands and that of the world think. They're like, we've seen it from Europe and other places, like we just need to get it below this level. So I loved his comments, but we've still got a bit of a reality gap with some of these people around what is antibiotic usage and what is good. So not to say I disagree, but how do we address it?
I think we need to do a better job in this country for both human medicine, but also for livestock animal welfare on why we use antibiotics, but then how we are abiding by the judicious and stewardship use of them. And I think that that's so critical. I think Dan made a lot of good comments about the safety of our food industry, but when you look at the National Beef Quality Audit and there's buckshot used in cattle that the packer's finding, like these are, maybe it's an educational awareness thing, but I mean,
don't shoot your cows.
There's the most basic of things that we can do to further ensure food safety. And I think, antibiotic uses, we are taking the best care of the animals.
Yeah. And once they're sick, yes, it's like, but I think what Dan also talked about was like, that's how do you prevent it through stress and welfare and all of that side of things. And I've seen that in the last 10 years, just there is more of a focus on stress, because at the end of the day, it's that stress that weakens the immune system and they get sick and all of that sort of stuff and relates to welfare. So I think, look, he's on it, right? But I think as an industry, how do we think about that as like the preventative side versus, if it's sick, treat it, right? But he also made the point, treat it right. Like don't treat it with the wrong thing, which comes back to your point, Joe.
Yeah.
Yeah, I like the animal welfare side of it as well. I think as an industry, we've really done a better job of explaining the welfare side of it, I think, to the industry. And I think we've always done a lot of the things, but I think we've just done a better job of embracing that these days. And I think the industry's improved. I think we've known it. I mean, we don't run into very many people that don't really care about their operation. The success of their operation depends on it, right? I mean, people just, the better the animals are, the better the health of the animals are, the more profitable the operation is going to be. It's just the way it works. And so we're all focused on that. We're all doing that. Some of us don't know what we don't know. Yeah. I think sometimes
that's the big thing. It's like everyone cares. We're not doubting that. It's just that sometimes, you've been taught by, like I was taught by your dad, and really that skill level is like where you inherit from a tradition. And if you don't try and push yourself and don't try and think about new things. And that's where the vet plays such a big role in being an advisor that can help you think differently and change the culture. And come back to that point, it's like, how do you think differently? How do you improve? What do you not know that you could do better?
Yeah, ask questions and learn, and I think all those things are important.
Yeah.
So.
And hopefully if you're listening to this podcast, you're already thinking like that. But, there is an element of how do we get people, in the whole industry to lift. And I think we all passionately feel about it. It's very clear Dan feels about that as well. Like, we don't want to have no man left behind if we can. Right?
Yep. Yeah, and I think this shows an example of the amount of information that's out there now to help people learn and understand and change the industry and transfer that information from producer to backgrounder to feed yard. And
that's the big change.
Be able to communicate, right? Yeah. We've been so afraid of communicating. Well, I think you mentioned it earlier. I mean, we've been afraid of communicating up and down the supply chain, and we really have got to do a better job of that. In order to be better.
I think we're all learning that there's something in it for us through that communication. And because of data tracking and individual animal analytics and stuff like that, like, you can now actually start to see the impact by communicating stuff back to the cow-calf or back to the backgrounder, where before it felt like there was no action that came back to it. But that's changing massively.
Or it was going to cause me to pay more money or something like that.
One of those sort of things.
Yeah. That was a good one.
Yeah, I like that.
Thanks, Jess.
Thank you.
Thanks for tuning in to today's episode of the Future of Beef show. Don't forget to check us out at thefutureofbeef.com with a free trial to Breeder app to take your operation to the next level. If you're enjoying the show, be sure to subscribe, share it with your friends, and leave us a review. We'd love to hear your feedback. Until next time, keep your boots on the ground and keep your eyes on the future.